Okay, Assalamu alaikum again, and thank you very much for joining this workshop. Uh, can you hear me clearly?
Yes, sir, we can hear you clearly and we can see your presentation.
Right. Okay. Now, for next, it's nearly 3 hours, we would be working on this area of interdisciplinary education, and it would involve some activities as well. And I'm glad that among the participants, we have both basic science teachers as well as clinicians. And then in basic sciences, we have anatomy, physiology, and biochemistry, which would be helpful in our hands-on activity later on. Right. Now, the first thing we want to see that what actually we want to achieve from this session, the learning outcomes. The first is to get the concept of interdisciplinary education and its relation with the integration in medical education. So two important words here is the concept and integration. And why integration? If you see the model of integration in medical education by Hardin, the interdisciplinary education is the 10th out of 11 steps in the integration in medical education. So we will be talking about that as well from different levels, that how we can achieve this level of integration. Then we will identify the teaching learning methods which are suitable if we want to implement interdisciplinary education. And of course, the advantages and challenges which we may face during interdisciplinary education implementation, and then how to handle those challenges and how to find out the solutions. And finally, ability to implement interdisciplinary education in our institutions. So this is what we aim to achieve from this workshop. Now, coming to the first, which is the concept and the of interdisciplinary education. The next few slides I will be talking on this. And so this is the first definition. Interdisciplinary education is an approach to teaching learning that integrates concepts, theories, and methods from multiple disciplines to prove a more comprehensive understanding of complex issues, problems, and topics. So as we mentioned earlier, so this is a field or level of education or integration which combines concepts, theories, and methods from multiple disciplines so that we can manage the complex issues more comfortably. Let's take the example here. Maybe, okay, we want to, let's say, make a surgical instrument. So what we need is, of course, a surgeon, and then so all three would combine their knowledge and skills to come up with the solution. So that is one example of interdisciplinary education. But the example I am giving here is of more interprofessional approach. Okay, it is an approach that involves the combination of knowledge from various disciplines to address multifaceted issues. So combination of knowledge from various disciplines. For example, in the field of environmental studies, so it would involve biology, chemistry, economics. In urban studies, it might involve architecture, sociology, and public policy. So means that people who are working in environmental studies or in urban studies, they need to get educated the concepts involved in these disciplines. The one great example of interdisciplinary education is One Health. And this concept got strengthened and its significance became very obvious during the COVID-19 pandemic. One Health is an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. Because the pandemics involve all these areas. If we look at a slightly elaborated definition, One Health recognizes the health of humans, domestic and wild animals, plants, and wider environment, including ecosystem, as closely linked and interdependent. And as I said, the pandemic, COVID-19 pandemic is the perfect example where all these areas are involved. And so the One Health concept covers all these areas. This means that to manage pandemics like COVID-19 effectively, we need to have personnel trained in all these relevant areas. That means a practical application of interdisciplinary education. Right. Now, going further, interdisciplinary, if you are, for example, an interdisciplinary expert, then you would have the ability, the cognitive ability to connect, translate, and establish links between discipline knowledge. So that would be the attribute of an expert in interdisciplinary education, their ability to connect, translate, and establish links between different disciplines. And not only that, but as well as metacognitive ability to understand and explain the role of disciplinary perspective in how knowledge is used and produced. So an expert in interdisciplinary education is expected to have these kind of attributes. Interdisciplinary instruction relies on multiple content, of course, because there are multiple disciplines are involved. So multiple content components working together to develop knowledge, problem-solving skills, self-confidence, self-efficacy, and passion for learning while supporting students' various learning styles. So again, it is a contribution by multiple disciplines through their multiple content. And the purpose is to develop the knowledge and the skills to solve the problems, etc. The skills to foster interdisciplinary understanding, the three major skills: critical thinking, collaboration, and reflection. Means that if we want to establish an interdisciplinary education, we have to have these three skills. We should have the ability of critical thinking, that means reasoning, able to and analyzing, evaluating, and based on that, making sound decision. Of course, collaboration means the situation awareness, as well as shared leadership. And of course, reflection means to reflect upon our previous experiences or our previous steps, so that how can we improve the the future steps. So 3 attributes: critical thinking, collaboration, and reflection are needed. Okay, now, although we will be talking about the advantages of uh, interdisciplinary education a bit later, but here just to highlight the rationale why we want to use interdisciplinary education for complex teach our health care professionals to be able to solve complex problems. Then we should teach or we should train them through interdisciplinary expertise. And the second is that it nurtures teamwork. So 2 major aspects here at this moment: the ability to solve complex problems or tasks, and second, to be able to work in a team. So, okay, now, as I mentioned earlier in our learning outcomes, that interdisciplinary education actually it equals integration in medical education, and we will see later the steps from integration in medical education, the famous ladder of integration, and we will see second last step of the ladder. So before we go further, I just want to clear the definition or concept that what we understand by discipline, so that we can understand what is meant by interdisciplinary education. So discipline is defined as a branch of knowledge that is studied and researched at an academic level. It is a field of study with its own theories, methodologies, terminology, and body of knowledge. Means that this is something which is academic in nature. A discipline here, but discipline we are talking about is academic in nature, and it has its own theories, methodologies, terminologies. For example, anatomy or physiology or biochemistry, these would be taken as a discipline, and because they are taught at the academic level, and they have their own theories, methodologies, and terminologies. So that is the concept of discipline when being go on. In medical education, interdisciplinary education means an integrated curriculum. Right. Now, looking at the integration in medical education, which here we mean the interdisciplinary medical education, how we look at the integrated medical education, the definition here is a fully synchronous, means real-time, transdisciplinary. Now, transdisciplinary is the 11th step in the integration, whereas interdisciplinary is the 10th step. So a fully synchronous transdisciplinary delivery of information between the foundational sciences and applied sciences throughout all years of a medical school curriculum. So we are bringing this concept of interdisciplinary education into medical education, And here it means that it is a real-time combination between foundational sciences, means basic medical sciences, and clinical medical sciences, not only in one phase, but throughout all 5 years of medical school curriculum. So that is a definition of integrated medical education. Another point, the organization of teaching matter to interrelate or unify subjects frequently taught in separate academic courses of departments. So this is the operational definition, where to interrelate or unify subjects frequently taught in separate academic courses. So this means, for example, we usually talk about preclinical years, or clinical years, or phase 1 and phase 2. So here it means that the subjects which are taught in 2 different phases by different departments, the integrated medical education would bring them together and interrelate and unify these subjects. The third definition, which again is the operational definition, the teaching different subjects areas in a thematic manner so that the different disciplines are not emphasized. We will be talking quite in detail about the thematic manner and themes, development of themes, and their role in the implementation of integrated medical education. Looking at another aspect, where this is an example just to help us to understand what it is taught in other areas. One term is used, integrated clinical education. And this is a definition which was adopted in 2017 by American Council of Academic Physical Therapy. We want to see how the other disciplines look at it. So integrated clinical education is a curriculum design model whereby clinical education experiences are purposely organized within a curriculum. Now here I want to give the example of phase 1 or preclinical years, because in our clinical years, of course, the clinical experiences are already included. So this means that if we want to have this integrated clinical education, means that we have to bring in our clinical input into so-called preclinical years. In physical therapist education, these experiences are obtained through the exploration of authentic physical therapist roles, responsibilities, and values, which is called the top-down approach. This means that if we want to bring in the clinical component into the phase 1, so we have to look at the roles and responsibilities and values of clinicians and the clinical disciplines, so that we can decide that which component from clinical areas can be integrated in the preclinical areas. So we need to apply this approach to medical education in phase 1. As I said, in phase 2, the clinical component is there, but we will talk later that we need to have basic sciences contributing in the clinical years to have vertical integration. So from clinical areas to preclinical areas, and from preclinical areas to clinical areas, so bi-directional contribution. The integrated clinical education refers to teaching approach that combines basic and clinical sciences to provide a comprehensive learning experience for students. And this method aims to break down barriers between different disciplines, promoting the retention of knowledge and acquisition of skills through continuous and progressive development of concepts and their application. So basically, it is an experiential learning where the students, preclinical students, see the application of knowledge, which they are learning in their basic sciences, how it is being applied in the actual clinical practice. And they go through this experience and get the benefits of experiential learning. Integrated medical education. In this model, students are exposed to real-world clinical settings early in their education. That's what we call the early clinical exposure. So traditionally, medical students were exposed to clinical settings in third year or clinical years, but in integrated medical education, it is that the exposure to clinical setting is from the day one of the medical school, of course, at the appropriate level of exposure. This integration helps in developing a holistic understanding and patient care. So that is the major plus point of integration in medical education, that is the production of all-rounded or well-rounded physicians or surgeons. So there is a holistic understanding of patient care, and including both physical, emotional, and social aspects. So that is one major aim of integration in medical education, or integrated medical education, that the doctors should be looking at the patient as a whole rather than as different diseases or components. So that is basically the concept of interdisciplinary education and its relationship with the integration in medical education. Now we will be talking about the further details of integration in medical education, so that we can understand the interdisciplinary education in medicine in proper context. Now, here is the statement by GMC of UK in Tomorrow's Doctors. And it says that we strongly favor true integration of the course, both horizontal and vertical, using the term in the sense of interdisciplinary synthesis and not simply coordination or synchronization of departmentally based components. Now, there are a number of terms used here: is horizontal integration, vertical integration, and of course, the interdisciplinary synthesis education, which we are talking about. And then is the term of what is coordination or synchronization. So the next few slides would explain all these terms and the concepts being mentioned in this statement. Now, here is to understand the concept of horizontal integration and vertical integration. The horizontal means information taught in the same curricular phase is taught together, usually processed around the theme or a problem. Now here, if you see, the horizontal integration means the integration within the basic medical sciences. So all the basic medical sciences which are taught, they are integrated within themselves, but they are not integrated with the clinical years. So similarly, the clinical sciences or disciplines are taught in an integrated manner, but basic sciences is not contributing there. Whereas vertical integration means that there is the basic sciences are contributing to the clinical years, and clinical years are contributing to the basic sciences. So if you see in the beginning, of course, the contribution by the clinical areas is very little, and it increases with time. On the other hand, of course, the major contribution is by the basic sciences, but it keeps on contributing even in the clinical years. So this way is the vertical integration, which means that phase 1 and phase 2 are the definition of horizontal integration and vertical integration. Any questions or comments so far? Anybody has any comment before we go to the further deep into the integration? All right. Anyone has any doubt or any point to share or clear any doubt?
No, sir. Thank you. Everything is quite clear till now.
Okay, let's move on. Now, there are five principles of integration. The first principle of integration is that it focuses on key issues, right? The emphasis of integration is on must know, are important things in the clinical practice, and integration focuses on clinical issues as it learning in the context, the clinical scenarios. This means that even in preclinical years, the most of the teaching sessions would be in a setting of clinical scenarios. So it is in context. So students are learning basic sciences in the context of medical practice. It adopts holistic approach because it covers all aspects of an issue in one go. It focuses around core curriculum, a must-know knowledge. And the second principle, and that integration enhances construction of knowledge, and it does through the integration of basic and clinical sciences, deep learning and understanding of new concepts, identification of gaps in knowledge and search for answers or use of resources. The classical example is a problem-based learning sessions where students identify the gaps in their knowledge and then try to address those gaps. And then application of newly acquired knowledge to solve problems, and typical examples are case-based learning and team-based learning. The promotion of application of knowledge to real life situation is the principle, and it is by learning through the problems, problem-based learning and case-based learning, because these are the areas where students would be applying their newly acquired knowledge in these situations, using knowledge gained to solve new problems, new situations, and getting feedback and improving the learning. The fourth principle is to fosters critical thinking and lifelong learning skills, and it is done through generation of hypotheses. I hope all of us are familiar with how we conduct the sessions, the problem-based learning sessions. And of course, the generation of hypotheses is a major component in problem-based learning, and which, of course, promotes the critical thinking. Interpreting data in case-based learning is one example where data is provided to the students and they interpret it. Searching evidence, making decisions, and finding relationships and identifying differences. So all these steps in integrated medical education nurtures critical thinking among the future medical professionals. The fifth principle that, of course, it enforces staff development because we are going into the new areas, new approaches to teaching and learning. So it improves teaching skills, mastering new techniques, learning how to give constructive feedback, enhancing evidence-based teaching, and keeping high standards and achieving excellence in areas of expertise. So these are 5 principles, or in other words, 5 attributes which are applied in integrated medical curriculum. And whenever we want to develop integrated medical curriculum, or here we are talking about interdisciplinary education, these are the principles which should guide us in such situation. Now, goal of integrated medical education, as I mentioned earlier, it is to produce well-rounded healthcare professionals who are prepared to meet the challenges of modern clinical practice with confidence and competence. And I think all of us now, nowadays, we really are sort of bombarded with this information of artificial intelligence and how it's going to change our teaching learning approach and how it's going to change the patient management and our way of our life. And that's the future, and only the integrated medical education can cover that, because it trains the students. It inculcates the habit of lifelong learning among these future medical professionals. So they should be ready to face any new situation arising in the future. Right. Now, after principles of integration in medical education, I have chosen some of the steps are the levels of integration, and the main purpose is to show where the interdisciplinary education stands in the level of integration in medical interdisciplinary education. So the level of integration is, first we need to understand that integration is not just one point. It is a continuation where the basic subject-based teaching is at one end and fully integration is at the other end, and in between there are different levels. That's what is stated in the SPICES model of educational strategies by Harder, that it is a continuum. There is a gradual increase in the depth or level of integration along this pathway, where we start with, let's say, discipline-based teaching, and we end up with complete integration among these disciplines and the subjects. Right? And we will be looking at that in the next few slides. Now, this is what is called the ladder of integration, or we can say the different levels of integration. So the first level, or the lowest level, is the isolation, and is the awareness. harmonization, nesting, temporal coordination. Then is the sharing, correlation, complementary, multidisciplinary, and interdisciplinary. This is where what we are talking about today. And then is the transdisciplinary education, is the integration in medical education. It is out of 11 steps, the 10th step relates to interdisciplinary education. Linked with our the today's session of interdisciplinary education is it relates to integration in medical education. Right. Out of these 11 steps, the first 4 steps on the ladder, they emphasize on there are 2 disciplines going parallel without having any link to start in this fashion, where the lecture are different disciplines. They did not know what is happening in the other side. Department are subject specialists organize their teaching with the considering of other disciplines are musculoskeletal system, physiology may be teaching cardiovascular system, biochemistry may be teaching renal system. So there is no link and no coordination at all. And this is what is called the isolation, fragmentation, or anarchy, are the first step of the ladder. Each discipline looks at the curriculum content in terms of area their own disciplines. So each discipline is totally independent. That what they want to teach, how much they want to teach, what should be the depth, what should be, what kind of timetable it would be, what should be the sequence. So it's totally decided by the discipline without considering what is happening in other classes. No attention is paid to other related subjects or disciplines which contribute to the curriculum. The relationship between subjects is not explicitly covered, and related topics from 2 disciplines are not intentionally correlated, as I mentioned earlier, that each subject is seen an entity in itself, and the subjects are seen as mastery of the subject. Too much emphasis on the subjects. Anatomy want the students to be anatomists, and biochemistry want the students to be the biochemist. And that is I hope it's not there anymore, but that was the situation during my medical school days, that every subject wanted the mastery of the subject by the medical student. Now that is the first level, and then, as I said, the first 4 levels are based on the subject base at different levels. Now let's move on to the 5th level. And the 5th level in the integration is what is the temporal coordination, parallel teaching, or concurrent teaching. Now, what happens here is that each subject remains responsible for its own teaching program. However, the timing of teaching of topics within the discipline is decided in consultation with other disciplines. Right? Now, we saw the fragmentation. where everything is going solo. But now at this level, although still the subjects are separate, anatomy is separate, physiology is separate, biochemistry is separate, but now when they prepare a timetable, they consult each other. So the timing of teaching of topics within the discipline is decided in consultation with other disciplines, and the implication of that would be that timetable related are scheduled at the same time. Similar topics are taught on the same day or a week. For example, if physiology is teaching functions of heart, that is the time when the anatomy would be teaching the structure of the heart. So this is the coordination, temporal coordination, that although still the subjects are being taught separately, but timetable is designed in such a way that the related areas are covered. So the students are not taught about the ministry independently, but they themselves have to see a link. Between the subjects. So learning is the sixth ladder on integration, which is the sharing or joint sessions. And here it moves a step further, that in the previous level, there was the parallel sessions, but covering the same area. Now here, the two disciplines may agree to plan and jointly implement a teaching program. Although subject-based, but there are joint sessions. So from teaching it during the same day or same week, the next step is where some joint sessions are conducted, and the overlapping concepts or areas make the basis for shared planning, and here students are shown the relationship between the two disciplines. If you see in the previous step, the subjects were being taught, but students were left to see the link themselves. But in this level, which is the sixth level of integration, there are joint sessions. So here students are shown the relationship between the two disciplines. Here is an example in the clinical years, let's say joint teaching between pediatrics and obstetrics, like infant of diabetic mother, obstructed labor, birth asphyxia. So means that it's the pregnant lady having diabetes, giving birth to a baby, and so there is the obstetrics would talk about the diabetes during pregnancy, and then the pediatrics would talk about the infant of diabetic mother. So there would be the joint session, so talking about the similar or same area, and the two different disciplines contributing to that situation. Similarly, obstructed labor or birth asphyxia. The other example, like community child health teaching program run jointly by Department of Child Health and Department of General Practice. So in community medicine, the sessions, combined session by the child health as well as general practice. So that is another example of sharing our joint teaching. Another example, parasitology and pharmacology. running a joint session on malarial parasite and anti-malarial drugs. So parasitology, let's say, going through the life cycle of malarial parasite, and the pharmacology teaching about anti-malarial drugs, and showing that at what level of this malarial parasite cycle these anti-malarial drugs would work. So these are few examples of joint teaching or sharing our joint session, and which is the 6th level of integration. The 7th level of integration is correlation, where subject, although still subject-based to some extent, but there are assignments and problem-based learning sessions, for example, which bring the disciplines together. So correlation, commitment program, our democratic program, the emphasis still remains on disciplines or subjects. Within this framework, an integrated teaching session or a course is introduced in addition to subject-based teaching. And the classical example is hybrid curriculum, where we still have the discipline-based teaching, lectures, all those, but at the same time, we have some problem-based learning sessions introduced. So in this way, we are now integrating the different systems or different disciplines through problem in the one the first example I gave you, for example, the parasitology and pharmacology. But if you extend it and you make a symposium where, for example, the medicine and pediatric people are also joining, so so that would be a good example of vertical integration, where the medicine and pediatrics can talk about the malaria and their patients, and parasitology and the pharmacology can contribute from the basic science. Disciplinary or interdisciplinary seminars or symposia. Assignments given to student is designed to integrate the subjects. So the topic is such that students have to go through different disciplines to complete that assignment, and the problem-based sessions, as I had just mentioned. Now, moving on to the next integration level, this is the complementary program or the mixed program. And here the integrated session represent a major. Now it's losing the subject identity, and the integrated sessions based on, for example, the themes are the joint sessions or sessions. So they a major component. Level 7 and different level 8 is actually the percentage of the curriculum being covered in one way or the other, and in level covered joint and before focus of teaching may be a theme or topic to which the disciplines can contribute. So the teaching would be under themes. I'll give you some examples, and we would have a hands-on activity on this as well. Now, how we develop a theme of the week. And let's say we are talking about basic sciences. We are talking about, let's say, a hemopoietic hematology or lymphoid module. And then we say that in this module, what are the contributing disciplines? If we are talking about basic sciences, among the basic sciences in this module, and let's say we have physiology, biochemistry, pathology, and from. So we think that these are the 4 disciplines which would have a major contribution in the module on hematology and lymphoid, our hemopoietic module. Now, what we do is that for each discipline, we request them that please give your 3 topics which you want to teach, let's say, in the first week, or the first 3 topics you want to teach. And let's say from these disciplines, we get these topics. Physiology says that we want to teach hemopoiesis. Biochemistry teaches the structure of hemoglobin. The pathology wants to teach on anemia, and pharmacology on iron therapy. Now, if we look at these 4 hemopoiesis, structure, hemoglobin, anemia, iron, so we a theme, a clinical situation which can cover all these areas. And it would be well that if we take the topic of anemia, that can cover all these, let's say, hemopoiesis, structure of hemoglobin, anemia, and iron therapy anemia. So for first week of the timetable of this hemopoietic module, we take the theme of anemia. And then we cover the different aspects of anemia, hemopoiesis, hemolysis, and hemorrhage. So all these topics can be identified, and then they can be put in a proper sequence. This is, let's say, the timetable. Now here is the hemopoietic and lymphoid system module. Then the theme is anemia. And then here we see, let's say, here is the normal hemoglobin, which is being covered by the biochemistry. Then is the hemopoiesis being covered by the physiology, blood grouping, physiology, hemolytic anemia by pathology. So you can see that all the topics here relate to the theme, which is anemia, and different disciplines are contributing. So although it's the different disciplines are contributing, but the important thing here is the theme of the week and not the discipline. So this is one example that how we identify the theme, and then we can struggle a bit with some lectures come earlier and some coming later part, but we have to maintain the sequence. The important thing here would be to, this means that we cannot change the sequence. We cannot change the topics. So normally we would say that we do not change the topic, we change the lecturer. Means that if some lecturer is not available on that particular day, we find another lecturer, but we stick to the topic and we continue with the same sequence. So that's how it is. The theme is identified, and based on that, timetable is created and implemented. So talking about the same, of course, not only the teaching, the assessment need to follow the integration. There's no point in teaching in integration, and assessment is different. So examination reflects the emphasis on both integration and subject or discipline based, like we would use modified essay questions, or the structured essay questions, problem-based questions, or extended matching questions. And then we would have assessment during small and have they can be tested by extended matching questions or MEQs. So point is not only, but the assessment need to follow the level. Then level, which is multidisciplinary or also called webbed or contributory. Now here, the multidisciplinary approach brings together a number of subject areas in single course. So we have now gone a step further that in level 8, under the theme, the concentrating on the theme, they were in the time. The identity of the disciplines would fade slowly. So level 9, the multidisciplinary brings together a lot of subject area in a single course with theme, problems, topics, or issues, the focus of students' learning. Now, that's how we now our timetables or our modules are divided on the body system. Like we have cardiovascular module, we have GIT module, and then under these modules we have the themes of the week, and then the teaching on that. Imagine if the same thing continues in the clinical years. Like we have CVS in the teaching. So following the same modules which we were using in the preclinical area, whether we can use the similar approach in the clinical areas, and like sciences are contributing to the theme of the week, simply the clinical sciences can contribute to the week. Just think about it, and what could be the implications. Now, the one is based on the body system. The other approach could be the organization of the curriculum based on the stages of life cycle. So rather than having systems, we say okay, conception through birth, then childhood, then adolescence, then adulthood, then elderly, and the death. So organizing the curriculum under these modules. As the themes may be based on the tasks, are based on the symptoms, are sometimes the pathological conditions. Now coming to level 10, which is our headline day interdisciplinary. Level 10 of integration of integration. So so it has to be more than what we have seen in level 9. For phenomena that involves the use of 2 or more academic disciplines simultaneously. In interdisciplinary integration, there is a further shift of emphasis to the themes as a focus for the learning. So Again, the major portion of the curriculum would be based on the themes. And here is that the interdisciplinary teaching implies a higher level of integration with the content of all or most disciplines combined into a new course with a new menu, for example, the One Health. So I gave you this example in the beginning. Disciplines, they combine and they come up with a new course, with a new approach. For example, we were talking about One Health, where the human health, the plant health, the animal health, and the environmental health, all those areas with the common goals are combined together, and a new course is developed. And the One Health, and the people would be trained in this One Health to handle any kind of epidemics in the future. It is one good there may be no reference to the individual disciplines, and they are not identified as such in the timetable. Only topics are given. Implicit in the move from a multidisciplinary, which is level 9, to an interdisciplinary, which is level 10 approach, may be the loss of disciplines perspectives, and the common learning outcomes from different disciplines are identified and integrated. Teaching, learning, and assessment is planned and implemented. For example, pediatric and community medicine or maternal and child health are the courses which involve multiple disciplines, but these courses, they pick up the common learning outcomes in these disciplines, and they become a new entity. The 11th level, which is the highest level of integration, is transdisciplinary, which is fusion or immersion or authentic. And the curriculum now transcends the individual disciplines. That means that individual disciplines are almost not identified. The curriculum in the first 3 years of the student studies is integrated around the body systems. And the last 2 years, students are attached for periods of time to a range of specialties in the hospital and community, and experience with context in which medicine is practiced. I think I'll explain this in the example here. This is the example from Dundee, and this is that they have identified tasks, provide the students with the framework for integrating the experiences. So after the, let's say, first 3 years of basic sciences under different modules, when they come to the clinic years, so there are no postings like medicine posting or surgical posting in that the traditional way, although there would be, of course, surgical training, medical training, but it would not be that traditional manner. And what is happening is that they have identified 113 clinical problems or tasks, and students have to work on these tasks. Each task, they would have a different perspective in each posting. Here is an example for example, let's say one task is abdominal pain. Now students have an acute surgical perspective in surgical attachment. This means that this is a task, and when student goes to the surgical posting, so-called posting, they would be looking at the patients with abdominal pain. The they are in medicine, and they would be medical aspect, and same task would be during obstetric and gynecology, and they would be looking at that task from the gynecological or general public attachment. So same task is makes the basis of their learning in different postings. So in this way, there are 113 tasks and through which the students would work. So it is totally a task or problem-oriented training, and in students going through different disciplines would be work on those tasks. By the way, is being in some schools. One of them is the Dundee. And the printed or electronic study guide is a key element helping the students with the challenge of integrating these different experiences. So students are really helped and guided how to go through these exercises. So it's more major component is managed by the students themselves. Here is another example that integrated clerkship in ambulatory care setting at South Dakota. The students spend their whole year 3 attached to clinics staffed by physicians from various specialties. So in year 3, students go to these clinics, and these are sort of multidisciplinary clinics, and students learn different aspects. Here in Malaysia, in UNIMAS, University Malaysia Sarawak, the year 4 students have the similar setup where they go to these clinics in the community, and then the teachers from the medical faculty travel to these areas, and they teach and help the student in those areas. So in this way, the students are not on any given specialty for a block of time. Rather, the required specialties are simultaneous and integrated throughout the year. And the students achieve the course objective at their own speed and by their own method. And the student is driven to find out and dictated by the prescribed tasks. So that is the whole concept of interdisciplinary education and how it is applied to medical education. Now, before we go on to this hands-on activity, I would be happy to answer if you have any questions. Anybody has any question or any idea, or let's say I might stop sharing and see if you have right. So you have any comments or questions which you need to discuss before we move on to the hands-on activity? Anybody has any comment or question? Yeah, Dr. Uzma Suhail.
Assalamu alaikum, sir. I am Dr. Uzma.
Walaikum salam. I believe you are
Yes,
from
sir.
obstetric gynecology.
Sir, I want to ask a question.
Yes.
Sir,
Yes,
I am
please.
from gynecology and also I am a medical education. I'm in medical education also.
Right. So what's the question?
Sir, I want to know
Yes.
how it could be possible for our university UHS to be at that level of interdisciplinary medical education or integration at that level, as the number of colleges which are attached to UHS are too many and the resources are very limited, faculty is limited, and the essence of integration is not been achieved since this is the second year we are passing through.
Right. Yeah, I'm partly aware of what was happening in UHS because I was many years ago. The idea was floated and some work was done, and at that time the Rawalpindi Medical College, now Rawalpindi Medical University, was actually spearheading with the concept that the integrated curriculum should be adopted. And as you are right, because there are so many, how many, 30 something medical colleges attached with the University of Health Sciences. So to bring the change
I think these are 46 or
46 is including dental,
Mm.
medical dental. Anyway,
yes.
so to bring a
Including dental, I
change,
think it may be.
yeah, to
It may
bring a change
increase.
in so many medical schools at one time, of course, is a very, very daunting task. And the discussion at that time was that maybe they should start with 1 or 2 medical schools, and it should be implemented there, and the teething problem should be addressed. And then slowly, gradually, the other medical schools should adopt. But major problem at that time was that the principals of different medical schools, they were not really ready for this. And now I think the university has sort of pushed it to some extent. But I fully agree with you. It's not easy to do the simultaneous change in 40 plus medical schools. So I think the approach probably would be that you identify, let's say 4 or 5 medical schools and implement it there and see, I have some experience before involving the other medical schools. Number 2, the question of resources is actually, you do not need much of additional resources for integration. It's basically reorganization of the resources, pooling of the resources. Now, for example, when I was medical student, we used to have a physiology lab and biochemistry lab, and so now we have one lab which is a multi-purpose lab, and the catering the needs of many disciplines. So basically, it is the reorganization of resources, and that would help. But having said that, it's easy to be said than to be done, and you really need a very, very strong will for this. I hope the present Vice Chancellor of UHS has that kind of will and approach to implement that. Issue is that if you do not do that, you would be left behind in medical education.